Hello and welcome. Today we're diving deep into a condition that primarily affects hearing but can sometimes have an indirect impact on vision, Enlarged Vestibular Aqueduct Syndrome, or EVS. EVAS isn't caused by any single factor, it's usually the result of a complex interplay of genetics and environmental influences. In many cases, it's associated with mutations in the cell C26A4 gene, which plays a crucial role in inner ear development. However, not everyone with this gene mutation develops EVS, suggesting that other genetic or environmental triggers are also involved. These triggers are still not fully understood, making pinpointing the exact cause in each individual a continuing area of research. The vestibular aqueduct is a bony channel in the skull that connects the inner ear to the intracranial cavity. Inside this channel is the endolymphatic duct and sac, which help regulate fluid balance and maintain the onic composition of the endolymph, the fluid in the inner ear that is crucial for hearing and balance. In EVS, this aqueduct is abnormally large. This enlargement can disrupt the normal fluid dynamics within the inner ear. It's believed that fluctuations in endolymph volume and pressure can lead to damage to the delicate hair cells responsible for hearing and balance. While EVAS itself doesn't directly affect the eyes, balance problems stemming from the inner ear dysfunction can lead to visual disturbances like vertigo and nystagmus, which is involuntary eye movement. These visual issues are a secondary effect of the inner ear problem, not a direct consequence of the enlarged aqueduct itself. EVAS is estimated to affect approximately 5 to 15% of children with sensorineural hearing loss. It is one of the most common inner ear abnormalities identified in children with hearing loss. While the prevalence isn't precisely known, it's considered a relatively common cause of congenital or early onset hearing impairment. The condition can affect individuals of all ethnicities and genders equally. The most prominent symptom of EVAS is fluctuating or progressive hearing loss. This hearing loss often begins in childhood and can worsen with minor head trauma or changes in atmospheric pressure. While EVAS primarily impacts hearing, the associated balance problems can cause symptoms like dizziness, vertigo, and unsteadiness. As mentioned previously, the balance disturbances can result in nystagmus or blurred vision. Although these are not primary symptoms of EVAS, the severity of symptoms can vary greatly from person to person, with some individuals experiencing only mild hearing loss and others developing profound deafness. Diagnosis of EVS typically involves a combination of audiological testing and imaging studies. An audiogram will assess the type and degree of hearing loss. The definitive diagnosis is made through imaging, typically a CT scan or MRI of the temporal bone, which reveals the enlarged vestibular aqueduct. A diagnosis of EVS is generally confirmed when the vestibular aqueduct is greater than 1 or 2 millimeters at its midpoint, depending on the specific criteria used by the radiologist. It's important to note that other conditions can cause hearing loss, so a comprehensive evaluation is essential to rule out other potential causes. There aren't distinct classifications or types of EVS itself, but the severity of hearing loss can range from mild to profound, and the progression of hearing loss can vary. Some individuals may experience stable hearing for years, while others experience rapid deterioration. The presence and severity of associated balance problems also differ among individuals. Currently, there's no cure for EVAS, so treatment focuses on managing the symptoms and preventing further hearing loss. This can involve the use of hearing aids or cochlear implants to improve hearing. Protecting the head from trauma is crucial to minimize the risk of further hearing loss. Avoiding activities that involve significant pressure changes, such as scuba diving or vigorous straining, may also be recommended. Vestibular rehabilitation therapy can help improve balance and reduce dizziness. Regular monitoring of hearing is essential to track any changes and adjust the management plan as needed. While there's no definitive way to prevent EVS, genetic counseling may be beneficial for families with a history of hearing loss or known SLC26A4 mutations. Early identification and manage hearing loss can help minimize the impact of EVS on a child's development and quality of life. Protecting the head from trauma is always a good practice, especially in individuals with known EVAS. The prognosis for individuals with EVAS varies depending on the severity and progression of hearing loss. Some individuals maintain relatively stable hearing throughout their lives, while others experience significant hearing deterioration. Early intervention and consistent management can help optimize hearing and balance. Research is ongoing to better understand the underlying mechanisms of EVS and to develop more effective treatments. Gene therapy is a potential future avenue for treatment, aiming to correct the underlying genetic defect. Studies are also investigating the role of inflammatory processes in the progression of hearing loss in EVS, which could lead to new therapeutic targets. Thank you for watching.